Hello everyone, this is Paul from Ortho Eval, and what I want to talk today about is hip arthritis. I want to talk about some do's and don'ts. Now there's a lot to talk about, so we're going to break this up into a couple different videos, but I want to make sure that you understand what hip arthritis is. I get this question all the time when patients come to see me at the clinic. They say, will this get better? Will my hip arthritis get better? And pretty much everybody who has hip arthritis is destined for a hip replacement if they're going to continue to be active during their lives. But if you're trying to buy some time and maybe that hip is not bad enough to have a hip replacement, then there are things you can do to keep yourself as active as possible without too much discomfort. So first of all, what is hip arthritis? Well, you have this ball and socket that is really deep in your hip here. And it's just like this, so basically a socket and ball, and when you're 18 years old, that's nice and glossy and smooth and runs really well. But as we get older and that joint starts to break down, the surface of the head of the femur and the socket become pitted. So it's like two sponges rubbing up against each other. It's not so smooth anymore, and the edges can be a little bit sharper and they can come around the head a little bit and cause some restriction when that ball is trying to work in the socket. So there's some physical changes that happen here that you just can't do anything about until you replace the hip. But it is possible to strengthen the structures around the hip as much as possible to give it stability and to keep the hip joint moving as much as possible so that it stays well lubricated and as loose and mobile as can be. So it's important that you avoid certain activities though when you have a diagnosed hip arthritis, okay? And one of them is this particular exercise called a knee to chest stretch, which a lot of people do. They pull that knee right to the chest and to try to make that hip a little more mobile and to stretch it a little bit, but that causes a significant amount of pinching inside the joint right here. The other exercise you should try to avoid is this diagonal knee to chest stretch where you're pulling to the opposite side. That causes a lot of pinching in that hip also. Another thing that I have people try to avoid is too much bending at the waist. When you do that, that causes a pinch in the hip, and you also get that when you're standing and bending a lot also. So try to go down straight if you can. If you have one arthritic hip, that one should try to stay a little bit straighter if possible. Now, the other thing you want to try to avoid are high impact activities. So if you are a runner or you do a lot of jumping, you need to try to avoid that because that's just going to continue to aggravate that joint. So it's not a bad idea if you want to continue walking and exercising on a regular basis to use something like a shock absorbing insole like what I use. That's very, very cushy, that absorbs shock, and research does show that that takes pressure off the joints and can make people with hip and knee arthritis more comfortable with their everyday activities. So I hope those do's and don'ts can help you deal with your hip arthritis a little bit better. I want you to stay tuned because we're going to have a video on how to strengthen the muscles around your core and your hips without causing more irritation to that hip. And then I'm also going to talk about how to position yourself on a bike better so that if you want to continue biking, you probably can continue to do that with a better posture and better position. So folks, I hope you liked our video today. If so, give us a thumbs up. Be sure to see the applaud button and subscribe to our channel so that you can get notifications every time we come out with a new video. Thanks again for watching Ortho Eval, pal.